Do you agree that I took a picture before? Photo for this.
台湾医师外科组就位，最后跟病患确认下刀位置，手术前置工作搞定了。乌克兰医师转介的这位病患，长时间来苦恼，脸上血管瘤越变越大，但因为靠近颜面神经，乌克兰医师不敢轻易下刀，交给台湾整形外科跟耳鼻喉科医师试试看。
我不怕。So then how do I dry them?
台湾医师到了乌克兰，什么都得适应当地，像是台湾一般医院都会有的共用手术服，在乌克兰得自备。于是手术前出现了内穿白色吊嘎、外罩隔离袍、国王的手术衣，但这丝毫都不影响工作进行。
If you have any discomfort, just tell us, but don't move. It's retractor.
台湾医师参与的这场手术，从划下第一刀开始，手术台边的医师越聚越多，从3个变4个，再变5个，有别台医师自己手术告一段落，赶场过来观摩。
Do the plastic surgeon use smaller instrument or same the cosmetic surgeon?
Skilled double pincel, more skilled.
I think the knife, the scissor is fine.
一边清除病人脸上病灶，一边解释手术技巧，大约40分钟就完成了，气氛一瞬间轻松不少。
Water bag, water with ice.
Треба холод півгодини потримати, мабуть.
Пиво баночное. Beer.
Чепон.
Beer.
Here?
We have cold beer
Here wrong.
from refrigerator.
So if this is Saturday, then it could be removed. The stitches can be removed on next Friday.
Easy? No?
Так, лежить, лежить.
Easy? No?
The numbness maybe lasts for a couple hours, but they will get well. It seems like a cystic mass in the muscle, but we remove it, and the pathology they will tell you what it is.
Дякую.
血管瘤不是困难的手术，但靠近颜面神经，乌克兰外科医师原本对要不要动刀有点犹豫，特地从利沃夫赶来的乌克兰医师实际观摩完整形外科怎么做，下次再遇到类似病患就知道怎么处理。
Watching it's very good experience. Your doctors have a lot of techniques. Also they quick this operation very quickly and professionally. So I'm glad to see and to change the experience with your doctors.
做这种，其实外科医师也都可以做，只是说因为位在脸上，或是位在这个颜面神经旁边周围，他们都会比较谨慎一点。所以既然来了，就能帮得上忙，我们就尽量做了。有些东西其实看过几次，就是你也觉得不会太复杂了。
帮忙开刀不是主要工作，示范教学才是台湾医疗团此行最大目的。诊间内原本排定手术病患的术前联合会诊，但诊间外长椅上还有辗转从其他医院来的病患，想说有排队有希望，看看能否跟台湾医师见上一面，帮忙评估。病患需要这么奔波，因为目前乌克兰医疗体系分为公立跟私立。战争前，私立医疗院所为国际跟国内有钱人提供专门服务，以人工生殖和美容整形医术先进闻名，医师赚得盆满钵满，吸引更多医师加入。而台湾医师来到的乌克兰 Mukachevo 的 St. Martins 医院，是有550病床数、颇具规模的区域公立医院。一般人来这里求医看诊，有健保分担部分医药费，缺点是除非医院之间相互支援，否则不一定每一科都有主治医师。加上战争，让医师的数量更少了。一般来说，国际医疗会在当地停留1到2周的时间，可以救急，但怎么样让影响力可以更长更远，就是透过教学。在乌克兰的医学院里面，超音波的学习跟应用是在战争时期非常流行的学习课程。
Just like me make it like not breathe.
Так.
The MO will keep like this shadow like buckle sign.
超音波教学课堂里，医学院学生到住院医师报名上课的人多到分成4组，一边看台湾医师实际操作跟画面判读，接着下一步每个学生拿起探头做做看。
Maybe you sometimes see the shadow was very dark. The shadow was not dark enough due to the cartilage.
尽管在全世界超音波技术早已成熟，超音波的仪器也从笨重固定式进化到只有像这样一台 iPad 大小，随时都可以拿着走。但在乌克兰医院，把超音波技术用在急诊判读，确实才刚刚起步，因此不是每个医生都知道怎么用。
We want to popularize it, because sometimes doctors think it's something very difficult. When you look at the screen of the monitor and see those gray, different shades of gray pictures, and you don't understand what's happening there. And some people think this is very difficult, but in fact, it's not so difficult. The main obstacle is to overcome this fear of the ultrasound machine and has it in hand and try it.
在俄军炮火战线的乌克兰西部，病患被紧急送到医院，有 X 光、有核磁共振，可以立刻对病患进行判断。但这些精密仪器很难带着走。在东部战地，状况瞬息万变，遇到急诊紧急救护，分秒必争，最有效率的判读仪器还是超音波。
If you have the portable ultrasound scanner in your hand, we call it a stethoscope of the 21st century. So it's a basic tool that any doctor can master and can help them in their clinical decision making. So you just have a probe, you have a patient, you have some questions. What could be inside of this patient gallbladder or inside of the kidney? Is there kidney stones there?
每一幅超音波灰色成像，每一条线条，每一处阴影，透过台湾医师实际手把手教学，才能知道代表的意义。即使对症下刀，或是给予正确治疗，医学生一毕业就能成为即战力。这也是乌克兰方希望借助台湾丰富医疗经验给予的最大帮助。
There's hundreds, thousands injured people, not only military but civilians who've been injured by bombs in Kherson, Kharkiv region all the time. We have doctors, but they have to be trained. We always not asking just for help. We want to be better. We want to know better. We want to have best doctors. We want to have best qualified doctors because we have a lot of patients and we have to treat them in the best way.
无论是手术室内医师观摩，还是即将毕业的医学生练习，从内科、外科、家医、急诊组成的台湾医疗团，正是乌克兰现阶段最需要的专家资源。只要教会一位医师，就能多救10个人。教学效益就像水面上的涟漪，持续向外扩散，让苦难中的乌克兰人，无论在哪，都能获得来自台湾的注意。